We'd be remiss to wonder if every single one of Joe Biden's attack lines on the debate stage tomorrow night couldn't or shouldn't circle back to Donald Trump's negligent handling of the pandemic. More than 206,000 Americans have now lost their lives due to the coronavirus pandemic as Trump pursued a strategy of playing it down, in his own words. Now, rising infection rates in 26 states are raising fears of a second national wave this fall. And now this, another sign that science is not what's leading Trump's response. NBC News' Monica Alba has confirmed that CDC Director Robert Redfield is voicing his alarm about the misleading data Coronavirus Task Force advisor Scott Atlas is arming Donald Trump with, telling a colleague over the phone, quote, "Everything he says is false." Joining our conversation is health policy expert and NBC News medical contributor, Dr. Gupta. I don't know if it's reassuring or depressing that the head of the CDC has to deal with a propagandist and conspiracy theorist inside the coronavirus task force, but I wonder what you think about this conversation that NBC News is reporting on, where Dr. Redfield describes Mr. Atlas as such.
Good afternoon, Nicole. I'm sure Dr. Redfield is just tired because Dr. Atlas has been wrong at every turn. So now, we've had about a month of having to deal with him at the White House podium. Let's see what he said. He says that children cannot transmit this disease, COVID-19, as effectively as adults. That's wrong. Actually, we now have data suggesting that children very easily could transmit COVID-19 just as well, if not better than adults. So that's number one. Number two, he propagated this myth that young adults somehow can't end up in the ICU and see me. Turns out that if you're infected as a young adult with COVID-19, it's the same risk of ending up in the ICU. So again, misinformation. And number three, he's Nicole, as you know, talking about herd immunity, with no empathy. Now we have great evidence from our own CDC suggesting that these spikes in the 20 to 29-year-old age bracket are preceded by a surge in cases among those who are 60 to 69 years old. So you can't engage in herd immunity and think you can cocoon off the elderly without putting people at risk. So he's been wrong at every single turn, which is why I'm sure he's seeing people inside the administration turn on him.
And we should just point out, in defense of Mr. Redfield, the man he's talking about, Mr. Atlas, said this about masks, that there's no sound science that shows you should have all populations wear a mask. On vaccines, he contradicted both Tony Fauci and Director Redfield. And he is someone who has no experience, no background in infectious diseases. But that's that. I want to know what conversation about the pandemic in tomorrow night's debate best serves the voting public from you, Dr. Gupta.
Well, I think I hope what you'll hear from former Vice President Biden is a return to science and perhaps elevating individuals into potentially his future administration that will focus on the facts, because Americans want to hear them. If I may, Nicole, can I share a few facts here? Because I'm getting questions all the time from individuals craving guidance. Fantastic. So number one, I've shown the N95 mask a lot here, but you don't hear from our Surgeon General, from Dr. Atlas. What if you can't access an N95 mask? Because this is the best fitting, most protective mask against COVID-19. Well, it turns out there's something called the 3-layer surgical mask. This is the type of mask, Nicole, that the USPS or something like it was going to be mass distributed to every household across the country. You'll remember 5 masks for every American household. The Trump administration put a nix on that. It's too bad because this is deemed to be pretty darn effective, better than cloth masks. What we know doesn't work are bandana masks. I see them all too often, or the neck goiter going up against the nose. It doesn't work. They're too thin. So that's one. Two, a big question I get is flu shots. When should you get a flu shot? The CDC has not been specific enough. They say end of October. You should get your flu shot now if you haven't already. It takes about 2 weeks to work. Get it now. For parents wondering about Halloween, go for a scavenger hunt at home, carve pumpkins at home, do a costume contest via teleconference, but don't trick or treat. It's really just too difficult. You're going to have to sanitize every single candy in and of itself. And then finally, I'll say, Nicole, the Senate is debating the HEROES Act. The HEROES Act would provide home caregivers, medical assistants, and respiratory therapists, neglected health specialties, the needed compensation and sick pay leave that they need. We don't talk about this enough. Our healthcare system, from a human personnel standpoint, that the weakest it's ever been, Nicole. We just don't, a lot of people have been furloughed and fired. And as we entered a dangerous phase, we need that connective tissue now more than ever. So I hope the Senate will act on the HEROES Act so we can get the right people back in place at work, providing care for Americans.
Tony Fauci has said that we need to get our number of new infections down to 10,000 a day before fall. We're still far away from that. What are your concerns as the fall is upon us?
Well, what I'm seeing is we're seeing now 40,000 new case rates a day. We're seeing a deaths remain at about 1,000. You know, Nicole, here's my concern. With that type of burden, we're entering colder climates. We know respiratory pathogens like to transmit themselves. I'm worried about the individuals who come in with flu or pneumonia that's not related to COVID that need a ventilator. Now you add on top of that COVID-19 and its burden, we are entering an unsustainable phase. My own Institute for Health Metrics at the University of Washington, they have modeled out, and models I know have pros and cons, that ICU capabilities will be stretched yet again come January 1st. So we all need to be concerned and focus on the policies that can help save American lives.
It's such a good point. We haven't been here in a winter season yet. Dr. Gupta, thank you for talking us through all of this. Thank you for your facts. I hope you always feel free to share facts. When we return,